Talking about thoughts, there are a few important things we should know. What should we know? One is, first of all, you should know about something called as healthy thinking. Healthy thinking. And the next one we should know is about thought disorders. Thought disorders. Let us try to understand healthy thinking first. What should you know about healthy thinking? When you're talking about healthy thinking, this concept was given by somebody called as Schneider. Schneider is the one who described healthy thinking. They said there are three components of healthy thinking. There are three components of healthy thinking. What are the three components? Constancy, continuity, organization. Constancy, continuity, and organization are the important components of healthy thinking. What does it mean? Healthy thinking basically means constancy, means you are able to stick to the topic which has been given to you. If I'm asking you a question on liver cirrhosis, you are sticking to the topic of liver cirrhosis and talking about it. That is called as constancy. Continuity means what? You are able to connect the various themes correctly. You're able to connect the sentences and words correctly and go on. That is called as continuity. What is organization? You're able to organize the information in priority 1, 2, 3. You are giving an introduction paragraph, then you're talking about etiology, then you're talking about pathogenesis, then you're talking about clinical features, then you're talking about investigations, treatment. Last line you will write, patients will die. So that is called as ability to organize the information. Sticking to the topic, continuity, and organization. Constancy, continuity, and organization are components of healthy thinking. You expect this in individuals, but sometimes it can lead to trouble. That is called as thought disorders. What are the important types of thought disorders we have? We have four important types of thought disorders. We have four important types of thought disorders. What are the important types of thought disorders? We have the thought form disorder, thought stream disorder, thought content disorder, and thought possession disorder. What are the four important types of thought disorders we have? Thought form disorder, thought stream disorder, thought content disorder, and thought possession disorder are the four important types of thought disorders we have. So let's try to understand a little bit more about each of these thought disorders, because you do need to know these things when you're going into any exam hall. Thought form disorder. There are other names for thought form disorder. Let's first understand that. What are the other names for thought form disorder? It is also called as formal thought disorder, disorder of thought form. It is also called as disorganized thinking. It is also called as loss of association or loosening of association, or also called as association loss. Extreme form of formal thought disorder. Extreme form of formal thought disorder is called as word salad. The other name for it is called as verbigeration. Verbigeration or word salad is the extreme form of thought disorder. You also can have neologism in these patients. What do you mean by neologism? Neologism means these patients are coining new words which don't even exist in dictionary. Suddenly the patient will say, "Sir, you are looking very abriki." You ask, "What is abriki, man?" "Beautiful, sir." "Which language? Latin, American, Spanish, Urdu, Malayalam?" "No. No, sir, my language." The patient has created a abriki word which is not there, and he says that is meaning beautiful. That is called as neologism. Neologism, coining of new words which don't even exist in dictionary, a very characteristic feature of which patients we are talking about? Schizophrenia patients. Word salad can be seen in schizophrenia patients. What is word salad? Also called as verbigeration. It is nothing but full kichdi. You just don't understand what they're telling. For example, you ask a patient, okay, tell me a few sentences about Bangalore. What does he start telling? Oh, Bangalore is people, the train came. Cockroach, it is Pani Puri. It is okay. Green 9 o'clock. Did you understand anything? No. Why are you not able to understand? I am telling English words, but it's all jumbled up. It's all word salad. It is all kichdi. That is why it is called as verbigeration. Verbigeration is word salad, which can be seen in which patients? Schizophrenia patients. So all of these are seen in which patients? Schizophrenia patients. Please remember, they can also be called as formal thought disorder, disorder of thought form, disorganized thinking, loosening of association, loosening of loss of association, association loss. These are all different names which are given to the same condition. Why do you call as this loss of association? All basically the words and sentences have lost the connect. Like if I have to draw and explain to you, it's something like this. A normal person will be able to stick to the topic and connect their thought process in a proper flow. A normal person will be able to connect the thoughts in a proper flow and things will be understandable, right? And it will be on a major single topic they'll be talking about. Major single topic they'll be able to talk about. This is what normal people will do. But what happens in these patients with schizophrenia? The thoughts are completely jumbled. Means what? One thought is overlaying other thought, the other thought is disconnected from the other thought. And sometimes the thoughts are completely illogical and you don't understand. So this is why it is called as loosening of association. What do you call it as? You call it as loosening of association. Now we are talking about schizophrenia, which is a psychotic disorder. So in some of the patients with psychotic disorder, the words and the sentences are completely jumbled up because of the prefrontal and the frontal areas are not able to prioritize and correctly bring out the right combinations. That is why schizophrenia patients can develop loosening of association or loss of association, which can happen actually in schizophrenia patients. Not all of the patients will have formal thought disorder, but some of them can actually have it. So when you're talking about formal thought disorder or loosening of association, one important point you should know is there is this concept of something called as derailment which happens. There is a concept of derailment which happens. You should also remember the other term called as tangentiality, very commonly asked in exam. What is this tangentiality or derailment? Especially tangentiality comes in MCQs quite frequently. Please remember here, they go away from the topic. If this is the topic they have to stick to, they will slowly deviate from the topic and go away from the topic, go away from the topic, go away from the topic. That is what is called as derailment or tangentiality, which can happen in these patients. Derailment or tangentiality. Getting it? This is again seen in schizophrenia patients. So they slowly deviate from the topic and get away, get away, get away. That is what happens. This should not be confused with another term which is also seen in schizophrenia patients called as circumstantiality. What is the circumstantiality? Circumstantiality is not supposed to be confused with tangentiality. In circumstantiality, what will happen? The patients will go away from the topic but come back to the topic, will go away from the topic but come back to the topic, go away from the topic, come back to the topic, go away from the topic, come back. So basically in circumstantiality, the patients will give unnecessary, boring details. What will they do? They'll give unnecessary, boring details. They will beat around bush. They'll beat around the bush. That is what they will do. We are all specialists in it, right? When we write exams, what happens? 10-mark question on a topic is given. We know hardly 3 lines about it. What do? We fill 3 pages. Write here, write that, put something and all, put some English into it, put some different languages into it, do something and write. In fact, sometimes we also draw some things in that. So that is called as circumstantiality, whereas giving unnecessary boring details is called as circumstantiality, which can again happen in these patients. So tangentiality, you go away from the topic but never come back. Circumstantiality, go away, come back, go away, come back. That is the difference between circumstantiality and tangentiality. Both can be seen in schizophrenia patients. Now, in some books, tangentiality and circumstantiality is described as a type of thought form disorder. In some books, circumstantiality is described as a thought stream disorder. So there is a controversy. It depends on which book they are talking about. In some books, circumstantiality is described as a thought stream disorder. In some books, it is described as a thought form disorder. So it depends on the source of the book we will talk about. Next is thought stream disorder. When I say the word stream, what comes to your mind? It is that flow, right? It is that flow. So when you're talking about thought stream disorder, we are talking about two things: flow and continuity. Flow and continuity. This is what we are talking about. I already mentioned to you, sometimes some books can say circumstantiality as a thought stream disorder because you're giving unnecessary details and coming back, So it can be considered as circumstantiality is also a type of thought stream disorder. Leaving that apart, let us understand other thought stream disorders. In depression patients, the stream can become very, very slow. The stream can become very, very slow, and retardation, that is called as retardation, can happen, and slowness can happen. This is very commonly seen in patients with depression. In depression patients, you can see the stream gets retarded or slow. Another thing which can happen is in some patients, as the stream is going like this, suddenly there is complete thought block which can happen. Thought block. Who are the patients who can have thought block? Thought block is typically seen in patients with schizophrenia. In schizophrenia patients, they can have sudden thought block. Suddenly they feel that the stream of thoughts are blocked and nothing else is coming. So it can happen in schizophrenia patients. Even extreme stress and anxiety can lead to thought block. It happens sometimes in your Viva exams, right? You're thinking and suddenly tapak, it blocks and nothing comes out of further. So thought block can happen in schizophrenia patients. Extreme anxiety also sometimes can lead to thought block. When you're talking about thought stream disorder, two things you should know, which is important, especially for exams, is this. One is called as the stream, instead of going like this, what happens in some patients, the stream can go up like this. That is called as flight of ideas. Flight of ideas. What is this flight of ideas? It is seen in patients with mania. These patients will have pressurized speech. They will have pressurized speech, and they also are known to have clang association. Clang association. What is clang association? Clang association means they jump from one rhyming word to another rhyming word. They jump from one rhyming word to another rhyming word. I'm going to America, drinka, binka, zinka, minka. So America, you understood. Drinka, binka, zinka, and minka are all examples of clang association. So clang association can happen in mania patients, and they can also have pressurized speech. Means they're talking very, very fast that you don't understand. They're talking so fast that you don't understand. Did you understand? No, right? Because I'm talking so fast that you might not understand. That is what can be seen in patients with mania. And they can also be thought to have flight of ideas. So what is flight of ideas? They're jumping from one idea to another idea. They're talking in a very, very fast pace. They can also be using rhyming words and jumping from one word to another. It is seen in patients with mania, and mania. The other one you should remember is thought stream disorder. You should remember is called as prolixity of speech. What you should remember? Prolixity of speech. Prolixity of speech happens in hypomania patients. And in these patients, you will have lively embellishment of speech. What happens in these patients? There is lively embellishment of speech. Instead of going very, very fast or something, here they add a lot of masala and emotions into the speech. Like, for example, a normal individual will come and tell you a story, something like, you know what happened yesterday night, 12 o'clock, when I was sleeping, The window opened and there was a white color sari lady walking, and I became very afraid. This is how a normal friend of yours will come and tell you. If the patient is having hypomania, and they have prolixity of speech, they will have lively embellishment which happens. So means what? They'll come and tell you, yesterday night, you know what happened? 12 o'clock. It was so dark and the dog was howling. Ooh. The wind was blowing. Zzz. The door was opening. Drrrr. So they add so much emotions and feelings that you actually kind of get, you are already starting to see some white color lady, as I'm telling you, right? That is what is called as lively embellishment of speech. An interesting point you should remember is prolixity of speech is also called as ordered flight of ideas. What is it called as? Ordered flight of ideas is called as prolixity of speech. Ordered flight of ideas is called as prolixity of speech. That's an important point for us to remember. They can test you in exam. Prolixity of speech is seen in hypomania. Pressurized speech, clang association, flight of ideas are seen in mania. Ordered flight of idea is the other name for prolixity of speech. These are all supposed to be remembered for you in exams.